Welcome to episode 5 of Preventive Edge Dialogues on preventive care, an initiative by Fortis in partnership with NDTV. Today, we focus on liver and gastro sciences. Now, with fatty liver disease becoming increasingly common, we'll explore its causes, management and progression to cirrhosis and transplantation. Our experts here will also discuss gallbladder stone disease, the role of endoscopy in digestive cancers, and everyday issues like acidity, bloating and indigestion. Joining me today here we have Dr. Vivek Vid, Chairman, Liver Transplant and HPB Surgery, Fortis Hospitals. Also joining me today is Dr. Brigadier Pankaj Puri, Director of Gastroenterology and Hepatology at Fortis Escorts, Okhla. Thank you so much, doctors, for joining us today. I think on this very, very critical conversation, because when we say liver, we were often told that liver is the jigger of the body. So again, a very important, and gut, gastro, extremely important again. Dr. Puri, I want to ask you, we see that fatty liver diseases is increasing. Every year we see that X amount of people are, getting fatty liver diseases. Why is that, and if you can tell us the causes of liver disease?
So, if you look at fatty liver, about 1/3 of us have fatty liver. It's going to be two group of people who will have fatty liver. One is people who have excessive alcohol. 90% of them will end up getting fatty liver. Second is people who have metabolic diseases. People who are obese, people who have fatty liver. About 1/3 of them will at least have fatty liver. And the second question was, what are the causes of liver disease? See, the common 4 causes of liver disease are alcohol, hepatitis B, hepatitis C, and fatty liver per se, which is not related to alcohol. Besides this, we have a long list of other things, and those are less common, including immune liver diseases and some metabolic liver diseases. But the common 4 are alcohol, hepatitis B, hepatitis C, and fatty liver.
Before I come on to the next question, I just want to ask you, because you said alcohol, which is something which is preventable. So what really is the right amount of alcohol one can take, if one has to take it?
That's a difficult question. The simple thing is the alcohol limits which are recommended are different in males and females. For males, safe limits are 2 to 3 small drinks, and each small drink is 10 ml. 10 grams, not the Patiala peg. And for females, their metabolism is different. The safe alcohol limits are 1 to 2 small drinks, not exceeding 5 days a week. Of course, people who are obese, people who have diabetes, any sort of liver disease, even these levels are not safe.
Okay, so that's the alcohol. What you said from the prevention and why it's increasing. Dr. Vij, if I can ask you, we've spoken about the reasons, right? At what stage of fatty liver disease does transplantation become a consideration, and what markers really, signal this irreversible progression?
Sure. So, Dr. Puri has talked about fatty liver disease, alcoholic liver disease. Every fatty liver disease or alcoholic liver disease doesn't need liver transplant, number one. There are typically progression of 4-stage progression in the disease. In stage 1, we have only fat in the liver. In stage 2, there is swelling in the liver, which is called as inflammation. In stage 3, we have fibrosis, which means there is a fiber in the liver which collects. And in stage 4, which we call lot of fiber and less cells, that is called as cirrhosis. Usually in the stage of cirrhosis, patients need liver transplant. But having said that, every cirrhotic doesn't need liver transplant. There are some stable cirrhotics who doesn't need liver transplant, who just need medical management. But it can't be reversed. It can be made stable with the medication and the management and avoid complications. But if cirrhosis leads to decompensations and symptoms like blood vomiting, like encephalopathy, kidney problems, water in the tummy or swelling in the legs, then probably it needs liver transplantation.
Okay, you've spoken about cirrhosis, and Dr. Puri, that's what I want to ask you again. Coming to cirrhosis, it remains a big challenge, and every time you hear the term cirrhosis, one worries if how serious it is. So obviously careful evaluation, long-term management. So how do you really approach the diagnosis? Of course, you told us about the symptoms and the treatment of cirrhosis. If you can take us to that, and what strategies have you seen in your career which are really effective for managing cirrhosis?
First thing is try and find the cause, whether it's alcohol, hepatitis B, hepatitis C, fatty liver. Cirrhosis, traditionally we were taught, is irreversible liver disease, but no, it's not. It is reversible, at least in its early stages. So we should try and find the cause. If the cause is hepatitis B and C, we treat the primary infection. If it is related to obesity and fatty liver and metabolic liver disease, we treat that. If it's alcohol, stop alcohol. Many of these people will revert. However, once we have diagnosed cirrhosis, we must remember that 10% people will worsen every year. They can have blood vomiting, fluid in their tummy, disorientation, and about 5% people will go on to develop liver tumors. So we screen for the disease, we treat the etiology, we will give some symptomatic therapy, which is supposing the patient has large veins in the food pipe, we will give medicines to decrease the veins in the food pipe, to decrease the pressure in those veins so they don't bleed. We will screen regularly for liver tumors. So we have a regular screening program where you do blood tests every 3 months. We will do screen for liver tumors every 6 months. And a year and a half, 2 years down the line, we will be screening for veins in the food pipe. So major things to look for is prevent decompensation, prevent bleeding, and screen and treat tumor development early.
So screening here is really, really critical, right?
Screening is
Timely
important.
screening, yeah.
Depending
on the stage, so it's easier to cure it at that point.
So as Dr. Vivek has just said, everybody doesn't need a transplant. We'll consider a transplant if the disease is advanced, the patient is decompensated. Medical management besides specific management is also important. Diet, exercise, these are important components of treating people with cirrhosis as well. They need much higher proteins. We have to make sure we look after their muscles, because loss of muscle, which we call sarcopenia, is an integral part of liver disease. And so we have to look at their diet, prevent them from, avoid fasting, increase the proteins, and do regular exercise. All these are, there's a lot which goes into medical management besides drugs.
And every patient has a different way of treatment, obviously. It goes,
Definitely.
So, thank you for that. Dr. Vij, of course, we've spoken about cirrhosis, and we are talking about how important screening is, and also the preventive, way, whether it's your lifestyle, eating healthy, again, giving up alcohol if needed. If we're talking about fatty liver, again, coming back to that, if it's diagnosed early, what are the most critical interventions you suggest that can really help prevent reaching the transplant stage?
That's a very important question. Before answering that question, I would like you to know that 1/3 of India's population, or maybe 1/4 or 1/3 to half population, is suffering from fatty liver disease. And in next 15 to 20 years, this fatty liver disease in 10% of this population will become cirrhosis and its complication, which is a huge number, huge burden on India's medical system as well as doctors. Now, having said that, the best way to prevent this pandemic or epidemic is to reverse this fatty liver disease. To reverse this fatty liver disease, I always suggest 4-pronged attack. One is diet, which is the central, weight management, exercise, and your stress management. If all 4 things are taken care of, you can easily reverse your fatty liver disease into a normal liver. And if you are not able to do this, there are a lot of latest medicines available, like Wegovy and other Ozempics and all. When medically indicated, they do wonders.
Only if it's really needed, because
Yes,
you said
of
the term
course,
Ozempic, a lot of people want to lose those extra
These
5
are not
kgs,
over-the-counter medicines. They have to be prescribed.
But ideally, you would suggest that a person, goes to the diet, try to lose weight, exercise. Those are the first things you say. Okay, great. Again, I want to ask you, Dr. Puri, is something very common we talk about, and people very casually say, oh, acidity ho gayi hai. Especially if I talk about urban India, I mean, when rural also says the numbers are changing, whether it's acidity, whether it's gas, whether it's bloating, indigestion. Again, we see a lot more happening. What can really be done about this?
First, we have to analyze these symptoms. Is the acidity only related to tummy symptoms, where they will just have burning in the upper abdomen? Are they having dominantly reflux symptoms? Or is this bloating just a part of irritable bowel? Acidity and increased acid-related disorders are often more in people who have smoking, who are popping in a lot of painkillers. It can also be associated with a bug or organism which we call Helicobacter pylori. So, if the patient is coming with symptoms, we have to see what is the cause of his acidity. Young people, a short trial of anti-acid medication is in order, but in elderly people or in people who are having persistent symptoms, an endoscopy should be considered.
So you feel that is not to look when what you said about helicopter pylor, right?
Helicobacter pylori, right? Sounds like a helicopter.
Yeah, sorry, yeah, because it's of course a very high. But we hear a H. pylori. Yeah, so a lot of people I also have seen that they have that, and then they have to take this long bacteria. Is it because in India we are more susceptible to it?
So it's very common. The prevalence would be there in about 70% Indians, but we would screen and treat people who are symptomatic. We don't need to screen for H. pylori and people who have no symptoms.
So you look at the symptoms and then of course the screening is done. Yes. And you said you used the term endoscopy. Well, that's my next question, Dr. Bij, for you. Again, that's like even Dr. Puri suggested it should be used if needed. So obviously it's a vital tool when we talk about modern gastroenterology. Could you explain how endoscopy contributes to whether it's early detection, diagnosis, or even treatment when it comes to digestive cancers? Because we see number of digestive cancer cases also going up.
So endoscopy is of two types, upper GI endoscopy as well as lower GI endoscopy. That is called as the upper GI endoscopy, esophagoscopy, in which we see the esophagus, upper bowel, stomach and the small part of the small intestine. Colonoscopy is done from anal canal and that sees the colon and bit of small intestine.
So the lower part
of the bowel. Now in many countries like Japan, where the bowel cancer is very high, there are screening programs every year starting from 40-45 years of age, and if we detect these cancers at a very early stage, they're very easy to manage. We can do endoscopic management, EMRs and many other treatments. They can be permanently cured. But if they are detected late, when we don't do screenings, then they usually come in stage 3 or stage 4, which are very difficult to manage, and the mortality of these cancers become very high in those situations.
So some of these endoscopies, there are some red flag signs. Who should have an endoscopy? Not everybody, person who's coming 20 years old really doesn't need an endoscopy to start off with. But if you're older, if you're anemic, your hemoglobin is low, if you had risk of bleeding, if you had blood in your stools, if you had black stools, if you've lost weight, and these are all red flags where you must look. If you have a family history of cancer, these are all important things where you must do an early endoscopy rather than waiting. We always thought that there's no colon cancer in India, but that's not true. There's a huge number in India. Our diet is changing. We now have a westernized diet. Fiber has gone lower. There's a lot of colonic cancer. In the West, everybody undergoes screening colonoscopies beyond the age of 45-50. I think the time for that has come to us now.
So more from the prevention, aspect. Well, thank you for sharing that. Well, on that note, so we'll take a really short break. Stay tuned. Welcome back. We're talking about the liver and gastroenterology axis, the sciences about it, and we have two experts here. Dr. Bij, I want to talk to you about gallbladder stones, which is, again, we see there are a range of symptoms. Different people have different kind of symptoms, and it does affect a person's daily life. Could you outline the clinical manifestations, how can it be prevented, and, the treatment as well?
Sure. So gallstones are very common in India. Like the most common reasons are fat, 40 fertile females, who have cholesterol gallstones. There are many other reasons like genetic reasons, breakdown of hemoglobin in thalassemias and sickle cell anemias, which can cause gallstones. The most common manifestation of gallstones is, like you said, dyspepsia, acidity, bloating. If you are in your maybe 30s or 40s, if you have dyspepsia, bloating, first thing to do is liver function test and ultrasound. And if there is a gallstone, then you should manage it. The management of gallstones, although there is prevention of gallstones, is basically prevention of is managing your lifestyle, healthy eating and maintaining your weight. But if gallstones happen in a patient and it's symptomatic, then it's important to remove it. I get many questions where people ask, can it be dissolved? Can only stone be taken out? That is not true. Gallbladder has to be taken out. At this point of time, gallbladder is dysfunctional. It is no more of any use in your body. It has to be taken out. If we persist with the same gallbladder and stone, studies have shown that later on it might become cancer also.
So, I mean, if person is at a young age, one should definitely take out the gallbladder if there is a stone. And I think that's a very important point which you've clarified, that the gallbladder has to be taken out. Yeah, okay. We've spoken about, of course, we were talking, thank you so much for explaining about the gallbladder stone. Again, increasingly common. We've spoken about endoscopy, but I want to ask you this question about technology, and I will come to you for innovation as well. But specifically when we talk about technology or the use of AI, we've been talking about how it's being used in the health space. If you can tell us for the liver and the gut.
So lots of things have changed in technology. So there are many liver diseases we never diagnosed earlier. Many of these are genetic liver diseases, and we can now go and evaluate what these causes are. Even in endoscopy, there's a lot of innovation. There's beyond the conventional upper GI endoscopy and colonoscopy, there's a whole host of new type of endoscopes which we have. We have endoscopes where we have ultrasounds on the tip. We can look at, do an endoscopic ultrasound. We can have endoscopes to remove stones which have slipped down from the gallbladder into the bile duct. We have endoscopes, we can see the entire small intestine, which is more than 20 feet long. So we have, those are balloon endoscopes. So lots of things have changed, the technology has changed, the imaging has changed, we can pick up early cancers, our screening modalities with high definition endoscopies have changed. Softwares are which now available, which will help in detection of polyps. If you just go through, you may miss the small little polyps. Those are polyp detection softwares are there. Radiological imaging to pick up, to be able to diagnose algorithmic AI. Lots of AI is the flavor of the season, and we have a lot of AI based softwares which will pick up lesions in the liver, tumors in the liver early. So technology is changing.
Quite a game changer here as well when it comes to the liver and gastro as
Definitely.
well. Dr. Vij, you tell us about a little bit. Of course, you've spoken about from the liver aspect. If I can ask you about the innovations you believe that will redefine liver transplantation in the next decade, and also just going back a little bit, what really is a liver transplant? When we hear that term, we just tend to panic, right? So tell us a little bit.
So any kind of transplant, a solid organ transplant, whether liver transplant, kidney transplant, heart transplant, means that patient's organ is in end stage of damage. So we have to actually remove that organ and place a new organ in place of that organ. So there are two sources for that, whether living donor, liver transplant can be done from living donor sources or from the cadaver, brain death sources. So having said that, there are a lot of advancements happening in the liver transplant field as we go on. In next 10 years, we will see a lot of AI coming into the algorithms and defining which liver fits which patients the best. AI would also help us in making the chains. Many patients don't have donors, but we have chain donors or swap donors that will help us in that. A lot of advancements will come into robotic surgery, where robots will be used with the help of AI. We'll analyze everything and we can actually do a very precise surgery. There are a lot of genetic modifications happening. AI is also helping in that. And new livers like xenotransplantation, that is transplant from another species. Like humans will be able to get a big pig liver.
That's a big one.
Yeah, so these are, a lot of research is going into, in fact, into the artificial livers, 3D printing. So all these things are in line. They will take 10 to 20 years to come in. With that, probably the need of transplant or of the living donors would go down.
So that puts less pressure, and accessibility to a liver will be easier. Well, thank you for sharing the innovation and of course how tech can be used. Again, a big game changer. Lastly, I want to ask you all about solutions. I'll come to you first, Dr. Puri. Practical solutions to keep our livers healthy. I think that's one. How does one manage it? If you could quickly tell us about the lifestyle changes.
Before we talk of practical solutions, last comment on transplantation. It's a shame that we can't run a disease donor liver transplantation in India, and I think we need more public awareness and to be able to do that. If you want to protect your liver, what do? First is look at simple things. If you have a screen for liver disease, if you have a history of hepatitis, if you have blood transfusions, anybody in the family has hepatitis B, if you've undergone some major surgeries, screen for hepatitis B and C. If you are obese, you are diabetic, screen for liver stiffness. Get liver stiffness done. There are some new machines which will look at transient elastography or something which we call a fibroscan. Look at your hardness of your liver. See whether there is liver disease. How do you prevent? First, it has to be a combination of diet, exercise, avoiding alcohol. These are the major crux of things to look for to protect your liver. If you're obese, you should be losing weight. Your target of weight loss should be between 2 to 4 kilos a month. In your diet, your saturated fat should go down. There should be increase of unsaturated fats. increase fibers, increase proteins. We all think that we're going to stop fats and we're going to stop sweets and the weight will go down. It never goes down. You have to decrease your carbohydrates. You have to increase your fibers, increase your proteins. Exercise is an integral part. It does a couple of things. First, it will change your basic metabolic rate. Whatever you eat will get digested faster. Second, the liver improves even if you don't lose weight, improves the liver further. And what is under recognized is it improves your resolve to lose weight. If you've done a good exercise, you're not going to eat a huge amount of calories. You say, I'm not going to waste that. So exercise is an integral part.
You're more mindful of what
you're more mindful. You're more mindful.
Yeah,
and the amount of exercise is important. You just don't say I walked 10,000 steps. It's going to do nothing.
Yeah.
What is the intensity? You should do brisk walking. If you're walking only, then you can't be talking to the person next to you. You should be doing a little more aggressive exercise. There has to be intent in that exercise. You should be doing aerobic about 45 minutes a day. Resistance exercise is about 1 hour twice a week, and that's the need. So I think focus on exercise for us Indians is very little.
I think that's a really interesting perspective. Again, we talk about healthy eating all the time. We talk about exercise and walking, more from other lifestyle diseases like diabetes. But for the liver, the way you've explained it, and I think the term which you've used, intent in exercise, that and the mindful eating really is the key. Last word to you.
Exercise.
And absolutely how important it's for the liver. Very often we overlook that aspect. So that's a very important point. Last word to you, Dr. Vij. What would you suggest? How do we keep our gut, stay away from, just stay healthy? Tell me about your last word.
So I think diet and exercise are central. That's Dr. Puri has stated. In diet, I would like to say, try and reduce sugars in your life. Try and reduce aerated drinks. Try and reduce your ultra packed products, and do exercise bit. Try to reduce the stress in your life. I think these three are the pillars where we can move towards healthy life.
Well, thank you so much, Dr. Vij and Dr. Puri, for speaking with us and sharing your expertise on these very two critical aspects of our body. So it's clear that the liver and gastrointestinal axis is not just about treating disease, but about nurturing overall well-being through prevention, lifestyle, and of course, innovation. The liver is also known as jigar, along with the gastrointestinal system, and this stands at the heart of our health, supporting digestion, detoxification, and vitality. A truly holistic approach blending medical expertise with everyday practices is key to protecting and strengthening digestive health for the future. Thank you all so much for watching.